medication side effects you never suspected. Some of the very prescriptions that safeguard health in later life can also create unintended ripple effects on the nose, throat, and airways. Clinical reviews on geriatric rhinitis point to several common culprits: ACE inhibitors, beta blockers, alpha blockers, centrally acting antihypertensives, diuretics, and certain psychotropic drugs. These are widely prescribed because they protect against heart issues, blood pressure spikes, fluid retention, or mood disorders. But alongside their benefits, they are known to trigger symptoms like nasal dryness, cough, or congestion-like irritation. For someone already experiencing slower sinus clearance with age, these effects can intensify mucus problems more than expected. Diuretic medications illustrate this clearly. By working to release excess fluid from the body, they protect the heart and reduce swelling. Yet this constant fluid loss, even at a low level, gradually dries out tissues of the mouth and nasal passages. In compensation, the body often produces thicker mucus that clings to the throat and makes clearing difficult. Many older adults don't connect this daily irritation to their prescribed medication, when in fact the link is well documented. Blood pressure drugs, especially ACE inhibitors, tell another part of the story. They lower blood pressure effectively, a life-saving role for many. But the catch is that one of their documented side effects is a consistent, sometimes nagging cough. For some, it feels like a need to clear the throat all day, and the sensation can persist through different seasons or dietary changes. Switching pillows or adjusting humidity doesn't resolve it because the trigger lies in how the medication interacts with the airway lining. Antidepressants and other psychotropic medications also appear on geriatric lists of drugs associated with nasal and oral dryness. Because many of these agents reduce saliva production, they change the texture of mucus. Saliva helps thin secretions and keep them from becoming sticky. So when it decreases, phlegm feels heavier and harder to swallow. Combine this with a normal age-related reduction in thirst, which already lowers water intake, and the result is often a persistent clogging sensation in the throat. The challenge is not just these individual effects, but how they compound when multiple prescriptions are taken together. A diuretic's dryness paired with an antidepressant saliva reduction creates an environment where mucus becomes thick, sticky, and unrelenting. Seniors may try all the classic lifestyle remedies: extra water, cutting back on dairy, using humidifiers, yet still notice morning congestion or all-day throat clearing. When everything else has been ruled out, side effects in the medication list may be the missing piece. It's important to be clear, these medications are essential. No one should ever stop or reduce a prescription without medical guidance. Hypertension drugs, diuretics, and antidepressants manage risks to the heart, brain, and overall well-being. The real solution is not to abandon them, but to recognize that if day-to-day comfort is suffering, medication side effects should be part of the conversation. Important, never stop or change a prescription on your own. Instead, bring symptoms to your prescriber and ask whether an alternative or dosing change might help. A good example is seen in routine practice. Clinicians often swap one blood pressure drug for another to reduce nasal dryness or cough. It's a common, simple adjustment when medically appropriate. In many cases, patients notice improvement within weeks. That change can mean the difference between living with a constant cough and starting the morning able to speak or sing without interruption. When raising the topic with a doctor, the key is detail. Mention when mucus feels worst, whether it's in the mornings after certain doses or during cold weather. Note any patterns of dry mouth, including nighttime dryness or trouble swallowing food. And always share a complete list of prescriptions. Geriatric reviews emphasize that medication review is a central tool for evaluating chronic rhinitis or cough in older adults. Without those specifics from the patient, patterns often remain invisible. The Relief possible through careful medication adjustment is often overlooked. For many, realizing symptoms don't have to be permanently endured changes their outlook. What was thought to be aging or unsolvable congestion may actually be the body responding to an avoidable irritation. In this way, side effects offer not just frustration but also an opportunity, a reminder to reevaluate, to ask questions, and to bring lived experience to the healthcare visit. This also raises a broader point about comfort. Seniors shouldn't have to choose between medical safety and daily quality of life. There is almost always room to balance both. When open communication with healthcare providers becomes the norm, mucus symptoms stop being written off as trivial and start being treated as real issues that impact sleep, speech, and confidence. For families and caregivers, this conversation matters too. Observing when a loved one clears their throat most often or avoids talking because of cough provides useful context to a doctor. Sometimes what patients describe as just an annoyance is seen more clearly by the people around them. Sharing those observations may help reveal medication as part of the cause. The guiding lesson here is that daily congestion doesn't always signal illness or lifestyle failure. Sometimes it's hidden in the pharmacy bag itself. And by reframing mucus as something that deserves medical attention, not just an inevitable nuisance, new pathways toward relief become possible. Even with the role of medications better understood, they're not the only factor making life with mucus more difficult. Another influence quietly shapes how airways feel, and it often explains why symptoms spike during certain seasons or in particular rooms of the home. When the air in your home becomes the enemy, cold weather months are often when mucus feels most relentless, but the reason isn't always infection or allergies. Much of the problem comes from the air seniors breathe inside their own homes. Heating systems, while essential for comfort, sharply reduce indoor humidity. Cold outdoor air already contains little moisture, and once it's warmed by furnaces or forced air systems, that dryness intensifies. The air becomes scratchy and irritating, and each breath pulls it deep into the nose and throat. The body reacts in the only way it knows how, by generating thicker secretions as protection. This same effect plays out in summer through air conditioning units. AC cools warm air, but also removes water from it. Seniors may find themselves congested in January and again in July, even when they feel healthy otherwise. It's not a coincidence. The pattern follows how artificial indoor climates strip the air of its natural balance. Older airways, already more sensitive because of thinning tissues and slower cilia, respond quickly to that lack of moisture. Instead of seeing this as just seasonal colds, it helps to consider the physiology in simple terms. Dry indoor air causes the lining of the nose and throat to become irritated. Irritation triggers more mucus production, which thickens without enough moisture to stay thin. That's why mornings feel clogged and tissues fill so fast. The cycle repeats nightly and doesn't improve until the environment changes. One retired teacher learned this firsthand. After nearly a decade of unexplained cough and heavy mornings, she tried different treatments without success. On a suggestion, she placed a small humidifier in her bedroom. Within days, her cough eased dramatically. It wasn't complex prescriptions or restrictive diets that made the difference. It was restoring moisture to the air she breathed all night. Practical steps can bring the same relief to many households, starting with humidifiers. Research supports keeping indoor air at 40 to 50% relative humidity for comfortable breathing and healthy nasal passages. By maintaining this level, mucus stays thinner, less sticky, and easier to clear. The machines come in all sizes, from small tabletop models to whole home systems. But one important precaution must be remembered. Humidifiers need regular cleaning. Without weekly maintenance, water tanks can harbor bacteria or mold, worsening symptoms instead of relieving them. ventilation is another straightforward fix. Stale, recycled air full of irritants only compounds dryness. Opening a window for 10 minutes adds a dose of fresh air and restores balance indoors. Even cold air helps when exchanged briefly, especially during long stretches when homes are sealed tightly shut. Quick ventilation sessions refresh airflow, dilute dry air, and reduce the feeling of never escaping congestion. Hydration inside the body is as important as humidity outside it. Many older adults drink less water than they should, partly due to reduced thirst signals. But dehydration thickens mucus and makes it harder to clear. Sipping water regularly through the day, and especially in the evening, keeps airway linings moist so the body doesn't need to overproduce secretions. Combined with balanced humidity levels in the bedroom, this step can transform both the quality of sleep and the way the morning begins. These simple measures don't require much money or equipment. A basic humidifier costs less than many routine copays, and plants that add small amounts of moisture to the air are available at most stores. Ventilation costs nothing. What keeps people from trying these fixes is rarely expense. It's a lack of awareness that air can be the hidden factor driving their mucus complaints. The benefits extend beyond mornings. Those who once avoided phone calls or social time because of disruptive coughing often feel more confident again. Nights improve when deep, uninterrupted sleep replaces repeated awakenings for water or coughing fits. Even small gains accumulate, shifting mucus from an unsolvable problem to a manageable one. Still, it's important to keep expectations realistic. Dry indoor air is a major driver of senior congestion, but it's not the only one. Some mucus problems persist because of reflux, medication side effects, or allergies. But tackling the indoor climate is a powerful first step because nearly every home with heating or cooling systems experiences some level of imbalance. By correcting the environment first, seniors set a foundation for other relief strategies to work more effectively. Another common oversight is assuming dryness only matters when it's obvious, like chapped lips or itchy skin. In reality, the nasal tissues can be struggling long before those outer signals appear. Inside, the airway lining cracks, dries, and triggers persistent mucus as its quiet alarm. Recognizing these hidden signs helps prevent months or years of unnecessary discomfort. So when mucus seems to peak every winter, or even through sweltering summer days with constant air conditioning, it may not be illness or unlucky aging at all. It may simply be the invisible dryness inside the home environment. Humidifiers set to 40 to 50% relative humidity, fresh ventilation, steady hydration, and proper device maintenance are low-cost, realistic supports that often make a measurable difference. Once seniors see how quickly indoor air compounds the problem, it becomes easier to see congestion not as a permanent sentence, but as a response to specific conditions. Relief is possible when those conditions change. And while the air you breathe is one powerful influence, there's another factor many overlook. What sits on the dinner plate each night may also help determine how much mucus greets you by morning. Dinner choices that backfire overnight. What many people don't realize is that evening meals can have a much larger impact on morning congestion than expected. Certain dinner choices, especially when eaten late at night, often set the stage for thicker mucus, a hoarser voice, and the constant need to clear the throat upon waking. One of the most common explanations in older adults isn't an allergy or sinus infection at all. It's something called silent reflux. Silent reflux, formerly known as laryngopharyngeal reflux, operates differently from the familiar burning pain of acid reflux. The mechanism is simple. As we age, the muscle at the bottom of the esophagus, known as the lower esophageal sphincter, becomes weaker and does not seal as tightly after meals. When lying flat during sleep, small amounts of stomach contents can move upward, even without noticeable heartburn. This acidic material reaches the sensitive tissue of the throat and voice box. Because those tissues are not built to withstand acid, they react by producing excess protective mucus. By morning, that extra mucus pools in the throat, creating the sensation of post-nasal drip, heavy congestion, and voice strain. This connection is often overlooked because the symptoms don't resemble classic indigestion. A senior may never feel burning in the chest or sour taste in the mouth. Instead, the only signs are a raspy voice, a dry cough, or the feeling of a lump in the throat that clears after hours of effort. Without awareness of silent reflux, many cut dairy, install humidifiers, or review their medications without improvement, never realizing their evening meal habits could be driving the problem. Consider how it affects quality of life. A hoarse voice in the morning can make phone calls awkward or singing at church frustrating. Constant throat clearing interrupts conversations and makes social gatherings uncomfortable. Coffee, which many people hope will restore alertness, can worsen the issue because caffeine relaxes the sphincter further, allowing even more backflow. The result is a daily cycle where each morning begins with discomfort and fatigue rather than a clean start. One example illustrates the process clearly. A retired grandfather dealt with heavy congestion every morning despite multiple adjustments to his environment. He tried humidifiers and medications, all without relief. During a checkup, a physician asked about his nightly routine. His habit was a large pizza late at night while watching television, usually followed by lying down soon after. With a few small changes, moving dinner earlier, avoiding eating within 2 hours of bedtime, and slightly raising the head of his bed, his symptoms began to lighten. Within weeks, mornings that once started with near silence due to mucus finally allowed him to speak clearly again. This situation is far from unique. Heavy evening meals, fried foods, acidic sauces like tomato, chocolate, citrus fruits, alcohol, and caffeine all relax the esophageal valve or remain in the stomach longer, enhancing the likelihood of nighttime reflux. Combine these foods with lying flat, and even a very small amount of backflow is enough to irritate the throat. The reaction does not appear as sudden pain. It shows up disguised as excess morning mucus. The good news is that practical strategies can help manage the condition at home. The first and most reliable step is timing. Avoiding food for 2 to 3 hours before bedtime reduces pressure on the weakened valve and allows the stomach to empty. Small adjustments, such as shifting dinner from 8 p.m. to 6 or 6:30, can make a noticeable difference. The second approach involves using gravity to an advantage, elevating the head of the bed 4 to 6 inches, or using a sturdy wedge pillow discourages stomach contents from creeping upward. The incline doesn't need to be steep. Even a small change is often enough to reduce nighttime irritation and morning congestion. Third, limiting common reflux triggers in the evening prevents extra strain on the valve. Tomato dishes, fried foods, citrus, chocolate, alcohol, and late cups of coffee are leading culprits. These don't always need to be eliminated entirely. Enjoying them earlier in the day and choosing lighter foods like soup, oatmeal, or roasted vegetables at night can keep reflux under control without sacrifice. Portion size also plays a part. Large dinners stretch the stomach and raise the chance of backflow. Smaller, balanced meals eaten earlier lighten digestive workload and reduce nighttime irritation. Many seniors notice that simply scaling down portion size at night feels better not only in the throat, but also in overall rest, since digestion no longer interferes with quality sleep. It's important to remember, however, that reflux is only one potential explanation. For many, it is a common but easily missed piece of the puzzle, not the sole answer. Morning mucus has other possible drivers, including dryness, medications, or environmental triggers. That's why considering reflux as one possibility, rather than assuming it is always the cause, keeps the perspective balanced and accurate. A few safety reminders matter here. Anyone with ongoing heartburn, frequent chest discomfort, or new difficulty swallowing should tell a healthcare provider promptly. Silent reflux is manageable, but more serious conditions need to be ruled out, especially when swallowing feels restricted. Seniors should also never self-prescribe over-the-counter acid-blocking medications long-term without guidance, since the necessary dose or drug may differ based on medical history. For those who want to experiment safely at home, try these first-line changes tonight. Stop eating 2 to 3 hours before lying down. Elevate the head of the bed by 4 to 6 inches and avoid tomato-based meals, citrus, chocolate, and alcohol in the evening. These adjustments address the most common contributors to overnight reflux. If symptoms persist or grow uncomfortable, that is the time to bring details to a physician and ask about further reflux evaluation or treatment. The most encouraging message is that silent reflux is predictable and often preventable. It is not a random, mysterious process. The morning congestion linked with it can ease significantly once meals are timed differently, food choices are adjusted, and sleeping position is corrected. For seniors who once resigned themselves to waking each day with heavy mucus, these changes show that relief is realistic. When these strategies do work, they improve more than the throat. Waking with a clear voice and less discomfort strengthens confidence in daily routines. It restores ease to conversations, greetings, and even something as simple as reading the newspaper aloud without interruption. These are small but meaningful improvements that add up to better daily comfort. Even with reflux under control, many older adults notice mucus still feels unusually thick and difficult to clear. That lingering heaviness has another explanation related to how the body manages fluids with age. Sometimes, what seems like a minor adjustment in intake makes a big difference in how mucus behaves the next morning. The hidden role of dehydration. One of the less obvious but highly influential contributors to daily mucus is dehydration.